I'm going to show Sydney today how to do a basic cupping job across the back. Okay. So we have our pump and our cup. This is a hand pump, creates the suction, and this is the cup. There's a nozzle here where the air pulls through here, creating the suction on the back. You load the cup onto the nozzle, give it a good tight push, and then it's loaded. So the first thing we're going to do is find the anatomical structures of the back. So we've got the spine here and the scapula spine here. You don't want to go over the bones, so you find these two locations and you put the cup right in the center. So it's already loaded, and then you set it on the location you want to cup. Hold it gently and do 5 to 10 pumps. 1, 2, 3, 4, 5, 6, 7. We'll do 7. Mm-hmm. Then hold the cup and twist this and pull it off. Okay. And then give the cup a tug to make sure it's on snugly. And that's how you do a cup. So when you get to the next cup, you want to make sure you have a few inches space between cups because the skin's going to pull up into the cup and you don't want them right on top of each other. Mm-hmm. So again, you load the cup into the hand pump, make sure it's in there tightly. Check for the spine, check for any other bony structure across the way, and put the cup in the middle. So we're doing 7 pumps right now. You can do more than that, just depends on the comfort level of the person you're cupping. 5 to 10 is usually a good range to go. And making sure it's on there snugly, which it is. Mm-hmm. So we just continue down the paraspinal muscles of the back, which are what give most people the most back tension. Checking for the spine, and then we're into the ribs here. That's fine to go over. And a couple inches here, placing the cup. And there you go. So getting down into the lower back, the ribs go away, and you're into the kidney region here. A couple inches, checking for the spine, going off the spine. And then getting down into the sacral region, which is really good to do unless you're pregnant. It's contraindicated for pregnancy, so do not do the sacral region if you are pregnant. And it kind of swoops up here, so you want to find a good spot to do it off the spine. And right there. All right, so now we'll go back to the top, and a lot of people have upper back tension. So again, you're going to check for the spine here and the spine of the scapula here, and then go right in between them. And we'll do the trapezius next. A lot of people carry a lot of tension here, so you're going to take your thumb and 4 fingers and kind of squeeze the trapezius, check the tension, and then do the cup right in the middle of the belly of the muscle. So you can probably do a few less on that spot because it gets pretty tight. And then going on to the neck, you're going to use a smaller size cup because you want to get the suction appropriate for the area you're doing. And then you want to make sure hair is out of the way, because if there's hair under the cup, the suction is not as good. So I kind of pull the hair up and hold it out of the way, place the cup off the spine, and then maybe fewer pumps here as well, maybe 5, because the neck is pretty sensitive. So the last 2 places we're going to do are on the scapula here, which is kind of a triangular shape. You want to find the perimeter of the scapula and then go right in the middle where the muscles and tendons are. And then I like to do right below the scapula, so here's the bottom of it, and you go right off of it to the ribs. It's kind of a lat muscle region. And this one usually gets pretty dark on most people, so it's a good spot to do. And that is how you cup one side of the body. I'm going to hand it over to Sydnie now. Okay. And she's going to give it a go.
All right.
This is Sydnie's first time cupping.
Yeah, we'll see how it goes. Okay. So I want to check right here, right?
Yeah, why don't you load the cup first, just to have that ready to go. Perfect. Okay. And then, yeah, checking for the spine and the scapula, border of the scapula.
So right here would be...
Perfect, yeah.
Okay. I just want...
A little fuller pump, yeah.
That good?
Like all the way, yeah. So you're gonna get good hand strength from this as well.
Oh, I can tell.
Yeah. So that looks pretty good. Yeah.
Just
so
twist it off?
Perfect. Yeah. Hold the cup, twist it off. That's exactly right.
Okay, all nice and snugly.
Yeah, exactly.
Good.
That was a perfect cup job.
Okay, and then 2 inches.
So load the cup first.
Yeah.
You don't want to press the cup onto the person. You just want to gently set it down.
Okay,
Yeah.
and then I do.
And a little more off the spine. So feel how the spine's there. That's
I
the
feel
border.
it. Okay.
So then go between it, about here and here.
Here. Okay.
Yeah. Because it's not very comfortable to have the cup on the spine.
Right there.
Perfect.
Okay. This is fun.
Yeah, and it's really easy. Like
It is
literally
easy. I thought it'd be a lot harder.
Exactly. Anyone can do it.
So feel spine here. So right here.
Perfect. Yeah.
Okay.
Making sure to leave, like she's doing, a couple inches between the cups so they have space when the skin sucks up. Doing great.
All right. Oh, this is pretty easy.
Yeah.
I thought it'd be like so much more difficult.
Yeah,
but I
anyone
guess
can do
not.
it.
Yeah, really.
So we're coming down off the ribs. It's a little more tissue here and less bone. This is where a lot of people have low back pain, the QL muscle. So this is a great place to do it.
Okay, and then this one is like the scoop one, right?
Yep, this is the sacral area. It kind of scoops up. Really wonderful place to do unless you're pregnant again. Do not do this if you're pregnant.
That's good.
Perfect. So let's go up and do,
These parts.
yeah, let's get the upper back here. And
Okay.
there's a lot of bone here, so make
Yeah,
sure you
so-
feel,
Right here.
perfect.
Okay. Oh, it is like hard to like grip.
Yeah, your hand can get tired if you're not used
I
to
can
it.
tell. Okay.
Okay, so let's do her trapezius next.
Okay. So this one I kind of have to grab first, right?
Exactly.
Oh, she's tight here.
Right, most
For
people are.
sure,
This is where
yeah.
people hold a lot of tension. So you can get a different angle, come around.
So
and
what would be good, like here?
perfect, like
Right from
that,
there?
coming from there.
Is that good?
That's perfect. Yeah, and then get it to start sucking up.
Think I got it? Yeah.
Yeah, that's perfect.
Okay.
Okay, so
Oh, wow.
let's do her neck next. So we're gonna use a smaller cup here.
Okay.
You can find it the right size for the neck you're working on. Different
Mm-hmm.
necks have different space.
Okay. So like here.
Yeah, and make sure it's off the spine. This is like a perfect
Yeah.
spot
So right
there.
here.
Yeah.
Okay. Like right there. Good.
Yes. Maybe just like 5 soft
Just little
pumps
ones.
because we don't want to get too tight on the neck.
Right.
Can feel a little intense.
Yeah.
And you just go with what the person's comfortable with.
Yeah.
If it's
How do you
too
feel,
much,
Montana?
I feel good.
Good. Okay.
great.
Good.
Yeah, so you can check in with them and see how they're doing.
It hurts. But
Yeah, the first couple minutes are going to be the most intense. There's a
Yeah.
lot of tightness and pressure,
Mm-hmm.
but after probably 2 to 3 minutes, that really dissipates and it starts to feel good in most people.
How long do you leave them on for?
Good question. Usually I do 10 to 15 minutes.
So right around here, right?
Yeah, so you're finding the border of the spine of
Yeah.
the scapula, and then
So-
right in the middle where all the
Okay.
tendons and muscles are. Perfect.
Okay.
And then the last one we'll do is kind of the
Right
lat
here.
muscle below the bottom of the
Okay.
scapula.
All right. That'd be like way more difficult, but it's not.
Yeah, super easy.
So right here.
That's exactly right. Yeah. Okay.
Okay.
You cupped her.
That's amazing.
Montana is cupped.
All right. There you go.
And that's it. So a lot of the benefits of cupping are musculoskeletal. It's going to increase blood circulation, bring fresh oxygenated blood to the muscles, clear out kind of the old blood, toxins, cellular debris through the lymphatic system. It's going to make you feel lighter, relieve muscle tension, can help with all sorts of things, and gives a great boost to the immune system. So you can do this at home on your own. It's very easy. You're going to have marks, typically some dark, shadowy figures. Depends on the person. Sometimes they're darker than others. That's autohemolysis, which is the destruction of old red blood cells and bringing in the fresh red blood cells. And those marks can last anywhere from 5 days to 2 weeks. It just depends on the person and the circulation. And you can do cupping, kind of as often as you want, but maybe once every week or two is good to do, maybe once a month, or if you have an acute injury, it's great to do on that to help the healing process. Montana's had these on for 10 minutes. We're going to take them off.
Okay.
Really easy to do, and it feels really good. These little nozzles, you pull this ball up,
Pull them up.
and then you hear the release.
Oh.
The air pressure releases, and then you can just take the cup off.
Oh, wow.
So it feels really good to do them all at once, really quick. A lot of tension
wow.
relief.
Feel really good.
Yeah.
Whoa. Okay.
And then you just take the cups off,
Oh, that's so easy.
and you're done. And that's cupping.
There you go. Oh. Cool.
That's it.
That was easy.
How do you feel, Montana?
Feel great.
Awesome.
Taking them off felt amazing.
Yeah, it's a sweet relief.